Hello everyone, in this video we will be talking about some nursing fundamentals, the nursing process, SBAR, IDT, and discharge planning.
Welcome to CASRN, where I teach you about all things nursing.
So first off, let's just talk about what we are going to review in this video. We're going to be talking about the nursing process, which is assess, diagnose, plan, implement, and evaluate. Then we're going to be talking about SBAR, which is how we want to communicate with the provider or another team member, the interdisciplinary team members and what they do, and discharge planning to make sure that our patients can go home safely. All right, nursing process. If you're not sure what to do, you got to take the first step here and assess. And this will give you more information. Because I'll tell you what, when you go to call somebody and talk to them and tell them what's going on, or you're not sure what to do. I remember once when I was a brand new nurse, I had a patient who was not reacting in the way that I thought was appropriate on his neuro exam. And I called my supervisor and I was like, hey, I'm not really sure what to do. And he was like, well, what are his vital signs? And I hadn't even taken his vital signs. So just remember, just assess. I know it's scary when the first time it happens to you and you kind of forget, but just work through that and remember to assess and then assess again. So first off, we are going to assess our patients. This is just going to be gathering our data, and then we're going to diagnose and interpret that data. So in the case of this patient, his vital signs were fairly normal. His blood pressure was a little bit low and his heart rate was a little bit low. But other than that, he was actually fine vital sign wise. And ultimately we decided it was a reaction with some medications that he had going on. So we were able to get a hold of the doctor and do what we needed to do. But I would not have been able to do that without my assessment, gathering the data, and then using that diagnosis to interpret the data. So then we're going to plan, and you want to set a goal of care for outcome. So we want to make sure that our patient is able to be safe while they're in our care. So in this case, we had to change some medication for this patient so that he could be safe. And then we implemented that in that we actually made the change and put notes in his chart and made changes to that medication. And then we want to evaluate that. So over the next couple of days, we were able to evaluate that, make sure that he was safe. And then we were able to recognize that our assessment and our diagnosis and our implementation had all turned out successfully. And so we evaluated that change and it was in turn successful. So take this, ingrain it into your memory. It's something that you need to do continuously. You do it in bedside nursing, you do it in community health nursing. Assess, diagnose, plan, implement, and evaluate. Then communication, or SBAR. This is what you're going to talk when you're saying what's going on with your patient. So we've got our situation, our background, our assessment, and our recommendation. Situation is going to be the patient name, room number, age, chief complaint, diagnosis, and procedures, or whatever you feel is pertinent. Then our background is going to be anything that inside the medical history that's pertinent to what we're talking about. Obviously, if this patient is 40 years old and they had a broken arm when they were 12, probably not pertinent. Okay, so then we're going to assess, and whatever we've assessed in that situation, or the reason that we're calling, like what's going on, this is why I'm calling you because this is the concern that I have. And then any recommendations that you might have. Doctors trust you to be the eyes on their patients. You're with them daily. The doctors maybe only see them for a few minutes a day or sometimes once a week, or, I mean, depending on the doctor that you're calling, it could have been months since the last time they saw them. So they really do depend on the nurse's eyes to tell them what's going on. So here's an example of what I might say to a doctor when I'm calling them. I would say, hey, this is Cassidy from Valley View Hospital. I'm calling about my patient, John Doe, in room 304. He's a 73-year-old male who's being seen for a recent stroke. I'm calling because I'm concerned about his recent neurological exam. This patient is confused. He's only oriented to person and he has weakness in the left hand. I'm concerned that the patient may have had another stroke, and I recommend that we get immediate imaging done. So we're going to keep it brief and to the point because that doctor's busy. We're busy. We've got a lot going on. So we want to just get our point across and let the doctor know what's going on. So then along with that, because it's pertinent to what we're talking about, we're going to talk a little bit about taking verbal orders properly. And so what we're going to do is, like, say that doctor, I call him and he wants me to take down an order. So we want to make sure that you're going to cover your date and time, the telephone, write down that it was a telephone order, the provider's name, the order, and then you want to sign your name to that, and that it was given to a person that could properly take that. So in this case, we would write down the date. So 10/21/22, it was taken at 14:30, so 2:30 in the afternoon, and it was a telephone order. We're going to write that it was Dr. Jerome Smith, medical doctor, who gave this order. And the order was to give 325 milligrams of aspirin times 2 tabs by mouth stat, and then order a non-contrast CT stat. And then I would sign my name, which is Cassidy, and then RN. And then the most important thing that you can possibly do is read back that order. It's so easy to make a mistake or to mishear a medication name or to not fully understand the schedule. So make sure that you read back that order to the provider to make sure that you got it written down properly so that that provider can then sign that order again later. All right, now on to the IDT. IDT is just short for interdisciplinary team. These are all of the different providers and healthcare team members that you might run into inside a hospital or a skilled nursing facility or in outpatient. You're going to see all of these different areas that can come in because we're treating the patient as a whole. And in order to do that, it does require the help of these various disciplines to ensure that the patient is able to live the healthiest life possible. So physical therapy helps treat the physical limitations and build strength. Occupational therapy focuses on daily movement, like getting dressed or brushing teeth. Respiratory focuses on the lung health and breathing. Speech focuses on swallowing. So we want to make sure that they're not going to aspirate. So if they've had a stroke or something there, they want to make sure that they can swallow safely so that they're not going to get aspiration pneumonia. Social work counsels the client and their families about various services that are available in the community or helps them recognize some of their needs and helps accomplish those. Nutrition assists with planning nutritional needs. Pharmacists formulate and dispense medications. Discharge planning nurse is a nurse that's going to coordinate discharge for that patient and does their best to ensure continuity of care after they leave the facility. A chaplain addresses any spiritual needs of the patient and their family. And then, of course, we've got administration that does the billing, the coding, the scheduling, and the day-to-day runnings of the facility. So discharge planning, just to touch on this, this really should begin when the patient enters the hospital. We have an ultimate goal of where we want that patient to be when they leave because they're not going to be staying here long-term, obviously. So our goal with discharge planning is to help patients live their healthiest life possible, and patients will discharge to a home or to a facility of some sort after staying in the hospital. So some may discharge to home health, which is when a nurse comes into their home and helps them with any skilled nursing needs that they can't do for a little while until eventually they can do it themselves. If you're working in a hospital setting, you need to do your best to send the patient on to their next thing safely. So this should be providing education, finding referrals, find out when they're following up with their provider, medications that are going home with them. So you want to make sure that you're anticipating those needs and educating them and their family. So a story that I had of a patient, I worked in home health for a little while, and I had a patient who was Spanish speaking, and I speak Spanish, and so I was able to go in and communicate with this patient in a good way that we had a great relationship. But her care inside the hospital and discharge from the hospital is actually really frustrating. While in the hospital, she had a bowel obstruction and ended up having to have surgery. Inside the surgery, they found that she had colon cancer. So they had to remove a good chunk of her colon and some of her bowel. And she came home with a colostomy. Well, her first day home at the hospital, they didn't send her with any materials. So if you're familiar with colostomy bags, they tend to leak, especially when they're brand new. The skin gets really sensitive around that. And when we went to go see her, she actually had a urostomy bag for her colostomy. It wasn't an actual colostomy bag. So there was no opening in the bottom that was big enough to be able to get that BM out. Rather, it was just a little tap thing that you do if you were going to do urine. So it was the completely wrong material. They sent her home with nothing. And then she was told, and if this was lost in translation or if it's actually on the doctor or the nurse or whomever, I don't know because I wasn't privy to the conversation, but they told her that she could eat whatever she'd wanted. She just had major bowel surgery, and after that you cannot eat whatever you want, and so she went home and ate a salad. And that caused severe gastrointestinal pain for her. They required her to take pain medication, and she actually ended up back in the hospital because she didn't know what to do. So a lot of this could have been avoided just by simple, good education and doing the teach back method with education, which is you tell the patient something and then you say, hey, I just want to make sure I explained myself properly. Can you tell me what you understood from what I said? And then have them tell you back what they understood from what you told them. And they may or may not have understood everything exactly as you wanted it to come across. And so it gives you an opportunity to clarify and make sure that they're going to do so safely. So inside all of that, I was able to help this patient. We were able to get her into a better place, but there was a lot of frustration and miscommunication in her process. Some of that being a language barrier, but a lot of it could have been resolved with a simple teach back method. So quick review, the nursing process is used daily and you want to make sure you do it. If you don't know for sure what to do with your patient, just assess a few times and then go and get some help. Our SBAR is really helpful in communicating quickly and efficiently with other members of the healthcare team. And make sure that you're writing down phone orders, and most importantly, making sure that you're reading those back so that they're done properly, just as much as you would do in teaching, where you have the patient tell you back what they heard. Same thing with phone orders. You would repeat that back to the physician so that you can make sure that that was understood properly. The interdisciplinary team treats the patient as a whole and comes in at multiple aspects so that we can make sure that person can return home safely. And our discharge planning really should be anticipated beforehand so that we know where that patient's going to go. And that may require helping that patient set up appointments with their providers. And most importantly, making sure that you're educating them and sending them home with the proper tools in order to take care of themselves.
Thanks for tuning in. Please help me grow my channel by clicking subscribe and follow below.